I'm Andy Goldsweig from the University of Nebraska Medical Center, and I'm here with Giuseppe Tarantini from the University of Padua, Chadi El Reis from Detroit Medical Center, and Ben Galper from the Mid-Atlantic Permanente Medical Group. We're here today to discuss social media for discussion of clinical cases and innovative techniques. This is part of a series of videos on this topic and on social media in general for CCI Journal, SCAI, and Wiley. To begin, I'm pleased to introduce Giuseppe to talk about discussion of clinical cases and innovative techniques on social media.
Thank you, Andrew. Thank you for having me. So before getting started with the discussion of the importance of social media in clinical case, technology and technique innovations, I think it's important to make a short premise that means that with this internet-based tool, we can gather individuals and community to share information, ideas, personal messages, and also, angiography, CT scan, echoes, and other contents. This is very important because when we focus to new technique, I think it's important to cooperate with others in real time. So let's focus on clinical case. Everybody knows that actually the heart team is class 1 indication for both coronary and structural heart valve intervention in both guidelines, that is American or S guidelines. Actually, this is not a reality, just a reality, but it's the gold standard intervention cardiology. By the means of social media, you may create a kind of global heart team to share second opinion or further opinion to your local case. And in this way, you can have a second set of eyes in a real time from far-flung colleagues. And this is very important. And, moving to the innovation, technology and technique, that are two different aspects to discuss. I think that's, we have the opportunity by means of social media to promulgate very rapidly, and we might permit a rapid uptake of this technique that are disconnected from the single journal or conference, or the possibility, whether or not you have the possibility to have a free access or another type of access to this journal or the conference. So let's make a few examples. For instance, when we discuss about the distal or radial artery approach that was introduced by Kim and A was launched by Twitter, in a year, this kind of, social media use for this technique permitted to have 1,000 institutions to be reached in less than 1 year in 5 different countries. And again, another nice example is the possibility to have a single access impaler-supported high-risk PCI. And with a video of 1.5 minutes that was launched in Twitter, more than 10,000 colleagues were reached out by this video in Twitter 4 months before the formal publication of this technique. So at the end of the day, what we can say that we have so many other examples like lithotripsy, leaflet laceration by means of basilica or lampoon technique, and many other type of step-by-step approach that permits to the intervention cardiology to learn immediately without having to wait for the case presentation during a formal conference. So in conclusion, ladies and gentlemen, what I think is about the importance of social media, I think the social media and these internet-based tools offer and provides a tremendous didactic opportunity for practicing intervention cardiologists and for trainees alike, and we may overtake geographical and financial barriers. Thank you.
Okay, now we'll introduce Chadi to speak about the first of 2 excellent examples of social media for dissemination of scientific information here.
Thank you, Andrew. Thanks for putting this together. So as we know, social media has been an imperative tool for cardiologists and more importantly, interventional cardiologists to share new technique and cases and innovations. One example, as you alluding to, is Jason Wilmoth, when he put together, this is a single access for patients who require high risk intervention with mechanical support, 14 French, and how you can access that with a sheet and a guide, so to minimize extravascular access. The dissemination of this technique has been beyond imagination. One example I can put, let's say Jason put together this and submitted to a journal for a case report and eventually get published, and that it wouldn't reach the number of interventionists and practicing cardiologists as it did through the social media. For sure, this is kind of change of practice. We have been implementing this in our lab, and I think many labs in the US has been implementing this, and eventually this technique has been published. But this is one example of many tools that I learned personally from the Twitter myself, new techniques, new wiring, new closure device, as well as new single access as Jason has illustrated to us, and a very easy and smooth and also a high penetration rate into the interventional community. Because as you know, Andrew and the team, is the number of cardiologists right now on Twitter is beyond 5,000, but majority of them are interventionalists. It's becoming the new platform, especially during COVID-19 pandemic, due to the cancellation of national meeting. So this new platform becoming the new kind of area for discussion of new technique, new technology, and also new paper and science, as we're doing right now on this video recording. So I think social media is here to stay. Social media definitely increase our knowledge and open our eyes for new technology and innovation in the cath lab and beyond, with a caveat that we have to protect the patient privacy and also follow the rule of HIPAA privacy. Thank you.
Excellent, thank you. Now we'll introduce Ben to tell us about another technique that I think many of us learned about on social media.
Thank you, Andy. Yeah, another great example of the rapid dissemination of new techniques and approaches in interventional cardiology and social media is distal left radial or snuff box approach to cardiac cath. In December 2016, Dr. Ferdinand Kimmene posted a video of the snuff box approach for cardiac catheterization and encouraged others to attempt it or try it. And it took off like wildfire. As mentioned, it really 5 continents across the country and over 100 institutions all adopted it within a year. And why did that happen? And it's a few reasons. One is on Twitter, there had already been a large following and interest in radial first and really pushing the radial approach over femoral for coronary angiography and intervention. And this kind of built on that further. It allowed for patients with bypass grafts to be easily accessed from the radial. It allowed a second access for right radial if there was radial failure. So the need for femoral access was diminished, which is great for our patients. Additionally, Dr. Kimmene kind of made it into a collaboration. As you see on this slide, he basically posted every picture of someone using distal left radial access on a poster in social media. And made almost a competition. So the first 100 people who post images will be included on the poster. And after anyone posted, they did this, he congratulated them, encouraged others to do this. And I got excited by it. I think I'm number 61 on his wall of fame here. And after I did distal left radial once, I really made it a major part of my practice. I use it now for all bypass cases, as well as a backup from right radial. And now my radial access for coronary angiography is greater than 95%. And my staff doesn't even prep the groin anymore, really all because of this new approach that I saw on social media. And it's just one example. I vastly expanded my structural armamentarium, as many others have, just from things I saw on social media for the first time, whether it be balloon valve fracture for valve and valve TAVR, shockwave facilitated access for femoral TAVR in patients with PAD, or tip-to-base lampoon. These are things I first saw on social media that I adopted. And as a result, I've expanded what I can offer my patients. I think this is why we all in interventional cardiology should hopefully be involved in social media, because it's a way to quickly learn about new techniques, vet new techniques, and adopt them so we can best help our patients.
Excellent. Well, thank you so much, Ben. Thank you, Chatty. Thank you, Giuseppe. And also thank you to CCI and to SCAI. It's great to join with you today. I look forward to seeing you soon on social media. And don't forget to follow at CCI Journal and at SCAI.